Emergencies don't come with a warning.
This is a more complicated injury when you break bones. The ambulance response time is less than 8 minutes, and that's why my role comes in to activate them before the patient arrives.
In the eye, you don't see that there's a fracture inside.
Losing a loved one is the most traumatic for anyone in their life.
It's a lot of intense conversation.
It is.
There's nothing wrong in doing the extra mile.
Is that they put toothpaste. Over the years, I've felt that there's a term called stress inoculation, and she hugged me and kissed my hand, and I was completely oblivious what's going on here.
What is one message that you want to tell parents? Welcome to the second half. Today's episode is going to be very intense and exciting as we're going to discuss about trauma and medical emergencies. What are the basics that we should be aware of while handling a trauma? What are the do's and what are the don'ts? What are those best things that we can do in the first few seconds or minutes that's life saving? We have more in conversation. Before we dive deep into it, please subscribe my channel and show some love so I can bring more insightful contents to you. With us in conversation, we have Dr. Syed Haris Huda. He's one of the renowned experts in the field of medical and surgical emergencies. He's working in one of the top hospitals in the pediatric emergency department, and he's also shaping future doctors as a faculty. Dr. Syed, welcome to the second half. I'm so glad to have you.
Likewise. Thank you, Amal. Thank you for having me here.
Yeah. So let's start from the basics in understanding. In simple language, what is trauma? Is trauma different from emergency?
Very good question. I think trauma is very difficult and it's a very different topic, and not everyone is used to dealing with trauma. Trauma is anything that happens as an injury to your body or someone who's with you as a person. It could be an adult, it could be a pediatric. Pediatric is the age group between 0 to 18, and they're more vulnerable because they're not as strong as adults are. So it could concur because of any injury. It could be a sporting injury, it could be a road traffic collision, it could be an accident at the swimming pool or at the sea. It could be an accident at the play area, even in the mall.
Yeah.
So it could be an accident anywhere. And it can lead to a lot of injuries to your body. We can talk more about it as we go along.
What about
Yeah.
it? So I just wanted to differentiate, what is this trauma situation.
Yeah.
Now, going back, let's break down trauma based on your experience here in Qatar and elsewhere. What are the basic trauma conditions that you've attended to, or the common ones?
The common pediatric trauma conditions that comes to the emergency departments for most in Qatar and everywhere else in the UK is in children group is the head injury. Children, because they are very active, mashallah, and they run around.
Yes.
They can hit their head anywhere. It can start from anywhere from 6 months to 18 years.
Yes, that's when they sit and then try walking and then.
Yeah, as rightly said, they at 6 months they start rolling out of the beds.
Yeah.
Yes, so parents are not they're very oblivious, and sometimes there's a new family and their first child, so they don't know when the child starts turning around.
Yeah.
And then the child turns in the bed and then rolls out of the bed and hit their head. So head injury is the most common presentation that present to the emergency department in children from 0 to 18 age group, more so early age. And this injury could be because while in the play area, like I said, or for someone who's in an adolescence age group, they're riding their cycle, hit by a car, or they're riding an ATV, and their ATV has an accident. So quite pertinent.
So what are the early indications that it's severely injured or something really bad?
Yes.
When it comes to head injury.
So specifically for head injury, if a person has got a child has got a head injury, they can lose their consciousness, which means they get all floppy. They will not be able to move, or they cannot, they cannot move from the point where they had the injury. And this could be sudden, which could be imminently after the injury, or this could be slightly after the injury as well. The second sign, which is a dangerous sign, is vomiting. when they start vomiting immediately after the injury. For example, a child had an injury half an hour ago, and now and it starts vomiting, and is vomiting more than 3 times. Now there is obviously these. The third thing could be, when they're bleeding from their head. So these are the major things, and obviously this is where we recommend them to come to the hospital and get themselves checked probably by a healthcare physician.
So if they fall and they have a bump on the head, what is immediately? Ice?
Yes, good point. I think the first thing is you console them. You put an ice pack on it, and if they're bleeding, you can put with something with a pressure, like a bandage, and then give them painkillers if they can tolerate the painkillers, and then bring them to the hospital for a proper physician check.
So, is there any mistakes that parents do out of panic when there is head injury or something that they should not do?
Yeah, I won't say it's a mistake, but then again, people don't know much about medical, and layperson, no one would know what to do next.
Yes.
And it's a fear and a panic situation when they see their loved one, their child, in that state. They're used to child crying all the time in the house, but when they see them with the injury, there's an element of guilt. There's an element that their loved one is in pain, and then they panic.
Yes.
Sometimes people forget to call the ambulance, or they don't remember the number for the ambulance because they're so hyped up in the heat of the moment. So what I would recommend is, when you think that your child has lost his consciousness, first and foremost, you need to be calm, because there is a situation which is easier said than done. Call the ambulance for a more medically trained person, or if you know anyone around you who can come immediately to support them. Make sure they're in a stable situation, a stable place, and
Stable in what sense?
Yeah. Sometimes children have these head injuries in the washroom. So they might be water, or they might be in the bathtub. Sometimes they hit their head to a glass or a mirror, and they could be sharp nails or sharp that can further injure in their body. So we have to be careful of that. So make sure we get them into a better, safe position and place, and then obviously call the ambulance first and foremost. And like I said earlier, if there is a bleeding point, if they're bleeding from specifically somewhere, just put tissue or a towel and tie it, even if it's on the head, and then just seek medical help.
Yeah. So you said calling ambulance because the impulse is to just put in the car and run. So do you think calling the ambulance is the best thing to do? How fast do you think the ambulance would come?
The ambulance response time is less than 8 minutes, which is phenomenal. In big Western countries, that time is not matched, unfortunately, because of the bigger countryside, and sometimes ambulance can reach it. But alhamdulillah, in Qatar, we have this exclusive service where our first responders reach there within 8 minutes, and they start providing the care. Depending on the need, if they need more help, they can call more ambulances, and within minutes they will be there as well.
So that's what we have to be aware of, because we get the first response within 8 minutes.
Yes.
So that's the best thing.
That's amazing. That's amazing timing, I would say. And worked in different countries in the world, that 8 minutes is a very, it feels like forever. But it is an amazing, response time by a medical expert. And these paramedics are people who come to help you as a first responder. They are trained. They are properly trained in their specialty, and they know what to do. And they will foresee it. If they need more help, they will call for more help. And then there's an alert system. If your child, God forbid, is unwell or is injured badly, they will let the hospital know in advance to prepare. And that's why my role comes in, where we get prepared, and my team gets prepared for this patient who's severely injured or ill. And then we make sure we get all the resources that we have in the hospital to activate them before the patient arrives. So this response system, again, is available in most Western countries, and now in Southeast Asian countries as well. And again, in Qatar and the Middle East, I think they have adapted that, and it works very well.
Wow.
It's very helpful as well.
It's impressive.
Yes.
Okay, now going to the next condition. So we spoke about head injuries or fall.
Yeah.
Okay, now fall also has something else. Like if you cut yourself, or if the child cuts themselves through something, accident, what as a parent or what as a bystander can we do immediately?
Yes. First and foremost, we should try to stop the bleeding.
Yeah.
Again, a deep cut can bleed a lot. So in order to stop the bleeding, anything that you have to hand, it doesn't have to be sterile. It doesn't have to be properly cleaned. Whatever you have, just put it as a pressure on that area of wound and just tie it. And as soon as possible, call ambulance so they can come. What ambulance can do is that they have other equipment that they can do to stop the bleeding, like something we call the tourniquets. And then they can put a cannula or like an IV line and start giving fluids. And this is part of the resuscitation of these children. So from parents' point of view, or who our listeners are or viewers are, I think the first and foremost thing you can do to save your child is to put bandage on it.
Or
And
tie
it with whatever you have. It could be towel, it could be a scarf, it could be a sheet, it could be a pillowcase, whatever. And then just make. If you have time and your child is awake, as a parent, you can give them some painkillers to relieve their anxiety and the pain, and console them, and stay with them. And when the ambulance comes in, just pop into the ambulance and come to the hospital for a review.
Okay, going to the next condition. What is the next common situation?
Next common condition is pretty much linked to the falls. Children from all age group from 0 to 18 can have their arms broken or their legs broken. They can have broken bones, fractures as we call them. And again, this can happen from anyone who's in the play area, is in the mall, he's in the swimming pool. And
playing football.
And it's playing football. Or the new generation is very into active and very into sports. Or riding an ATV at the sand dunes or somewhere, where parents think the least that it can happen is that he or she will have an injury. Now, obviously, this is a more complicated injury when you break bones. When you break bone, it obviously has pain. And there's a significant amount of pain which will not be relieved with just regular painkillers. Then along with that, we have to make sure that they don't move that part much. So we have ways of splinting them. And again, the splinting devices and stuff is not available to common person. So the idea...
Splinting, viewers to understand. Splinting is tying it with something for...
So tying it and making sure it doesn't move much. For example, if I have an arm injury, just tie something around my neck and just to hold it in that position, in the position of comfort for the child.
But let me break this down. In the eye, you don't see that there's a fracture inside. You just say that it's an acute pain or swelling. So how do we actually assess or feel that it has to be tied or splinted?
Very good point. And most parents would do that. They would not know. Either it's broken, it's under the skin. I would not know. I'm not medically trained. I think the safest thing would be to overtreat it and consider that there is a fracture until you see an expert.
There's nothing wrong in doing the extra mile.
Yes, there is nothing wrong. And obviously, you're doing good to your child.
True.
And there are lots of fractures which just need splinting, like having a cast or having a POP, and that will help them recover and heal. So not every fracture needs an operation. So the idea is for your journey from home to the hospital is to make sure they're comfortable. You think they can take painkillers? By all means, you should give them painkillers. Put them in a comfort position by putting a pillow under the arm or pillow under the leg, and call the ambulance again. When the ambulance brings the patient to the emergency department, we will give them more stronger painkillers according to their weight and age and their condition. Once they're pain-free, we'll make sure we get some x-rays done for them. Depending on the x-ray results and the injuries, we will make sure we provide the best care, which is sometimes making them their arms and legs straight, or getting them to the operating room as soon as possible by getting the expert help from the orthopedic doctors, the bone specialist doctors.
This might sound funny, but as a parent, even me too, like if my son, he falls down, I immediately pull him, rub him, or, try to massage. So is that doable, or that's not the right thing to do?
I think it's natural that we do. Wherever we get hurt, we start rubbing it. Rubbing can do more damage to the tissue. I would not recommend doing that. The idea is, again, what we can do is to put an ice pack there, splint it, or by putting a pillow or something underneath it, just to put them in a comfortable position. You're not a trained person at home, so you don't have to pull or do anything. Just try to put a comfortable position. And then if you have a bandage, just put a bandage on top. Make sure they have the painkillers. You've called the ambulance. You come to the hospital for seeking the definitive care.
Now, any other condition that you find as a common? So we spoke about burning, spoke about accidents,
Yeah.
fracture,
Yeah.
bleeding,
We didn't.
drowning.
Yeah. So drowning is common, obviously, especially in this season when we have a very long summer,
Yes.
and then we are very tempted to go to the beach, and we have fantastic pools here. Good thing about where we are at the moment is that there is a lot of safety netting. There are lifeguards around swimming pools, but they could be an untoward incident if they've been overseen, especially kids who do not know how to swim.
Yes.
From parents' perspective, I would recommend that every child should have some level of swimming training. They should at least survive in some deep, shallow water they can manage there. And if they are not trained, they should be supervised by an adult. God forbid if they're gone into a difficult situation or they are drowning or near drowning, the parents can rescue them, bring them to medical attention, and call the ambulance.
So if there is a child that is from received from the water, so okay, you try to give the what is that called? CPR.
Yes. CPR stands for the cardiac pulmonary resuscitation. I know it's a bit of a mouthful, but CPR is a good way. Obviously, depends on the condition of the patient. If the patient was drowned in the water and was under the water, you've called the ambulance for expert help. You get the patient out, you dry them with a cloth, cover them, and see if they are taking breaths or not. If they are not, then obviously, if you know and you know how to, if you are BLS trained, which is the basic life support train,
Yes.
there's a free training going around in the country as an initiative, or you have trained in at work, you can provide the CPR, which is you are manually compressing the chest
Yes.
to get the heart to start pumping blood. And then when the heart pumps the blood, it goes all around the system and it goes to your brain,
Yeah.
and it will help your brain function again. So it's okay to do that if you're a trained person. If you're not trained person, I rather you get some expert help for that and calling ambulance sooner than later. But thankfully, as I said earlier, we have lifeguards everywhere, and they jump in, and there are people who are medically trained, nurses and physicians, who will jump in to provide the help and then provide the resuscitation what is needed before coming to the hospital.
Coming to choking, doctor, it's often found in kids, like from infants to even adults, it can happen. So, from kids, the common thing that we do as mom that you've seen is we pat the kid down and then we rub the back or we tap the back.
Yeah.
So, is that the right thing to do?
Yeah, I think for kids who cannot cough or cannot produce cough, or in that age group, you can pat the back. If you've seen something that they're just eating for, like they're eating a grape or something, or they're playing with a toy in their mouth, and they might have inhaled or taken it down their food pipe or in their windpipe, tapping would help. If you see anything in the front of the mouth, for example, you can try taking it out, but you do not. You have to be careful with that. You do not want to push it further down.
Yeah.
So patting on the back is okay. For slightly older kids, which comes for age group from year 4 onwards, you can do something which is called the Hamelic manure, where you can put your fist in their tummy, in the upper part of the tummy, and push it from backwards. 5 times you can do that, and 5 times on the back. And each time you look at the child's condition, if they're breathing. First and foremost, for adolescents age group and anyone adult that you come across, for example, you're in a fancy restaurant, or you saw someone choking on food, if they're awake, you can ask them to cough, and the more they cough, they it's a high chance they will bring the foreign body or whatever they've eaten as a bolus of food or whatever, it will come out. If not, then you can try the Hamelic manure. There are lots of videos on YouTube you can find about Hamelic manure. So the way you do it is like you put a fist in the tummy, you push it upwards, 5 thirst from the front and 5 pat from the back, and then you keep looking at the person's condition. If you think that this is getting just it's not getting anywhere, I think again seeking expert help would be helpful. But
How crucial is those? Like how many minutes, or how crucial is that situation?
it's very difficult. If you feel for, well, if you try to hold your breath for a minute,
Yes.
you would recognize how panicking and how difficult situation is that. And this person cannot breathe very well because there's something blocking the windpipe. So it's a very difficult situation. And then people collapse and they lose their consciousness with it. And that's when you have to start the CPR, like you were mentioning earlier. So the situation is gone from worse, from bad to worse. And then that patient needs CPR resuscitation so we can still pump the blood to the brain and get the brain function. The way you need to understand this, and my viewers need to understand this, is that the longer the blood circulation doesn't go to the brain, the worse is the recovery, and the outcome would be bad as well. So the sooner we do the CPR, and this is why I would recommend anyone who's listening this and watching this to have some level of basic life support training, because in this ever so changing dynamics of the world, we should all be trained how to manage initial resuscitation or stabilize patient before the ambulance comes in. And they have fantastic response time, but then again, as a bystander, and it's been proven by research, the sooner you start the CPR, the better is the outcome and the better is the long-term recovery.
So you mentioned that you should start CPR immediately because blood should reach the brain. What if there is a delay? What worse can happen? Apart from death, but what worse can happen if the person recovers? Does it go into a stroke kind of situation?
Yeah. So it's not going to be a stroke situation, but what happens is each minute that patient's blood circulation is not reaching to the brain, the chances of recovery is 10% less. So, for example, if the ambulance response time is within 8 minutes, so 80% of your chances of recovery of functional brain, where you can walk, talk, and eat food yourself, will go down. And this is the worst case scenario. So the sooner you start, the better it is. So hence the reason, again, my point that we should start some level of training. And there are a lot of national initiatives going around where physicians and nurses are training children in school how to call for help, and in the offices, that this should be a mandatory part of any induction program in any office, that God forbid, and you can expect the worst. We recently heard something of an IT firm where a security guard had a cardiac arrest because he had a heart attack. But there was few trained staff members, obviously, who didn't panic the situation, make the best of the situation by starting the CPR and call the ambulance, and the ambulance crew came, and he had 100% recovery. So alhamdulillah, this can happen, and obviously timely action helps long-term recovery.
That's the whole point, because we need to be aware of all this, because emergencies don't come with a warning. It just happens. So you have to be prepared and not panic and do the right thing.
Exactly. I totally agree.
That was helpful, doctor. So coming into burns now, we didn't talk about burns. So what are the basics that we should be knowing in this situation? Like, what are the levels, the degrees of burns, or from minor to major? When should we run to the hospital?
Good point, and a very pertinent injury that patient present to the emergency department. Burns could be different types. Burns could be because a hot water spill on someone. Burns could be you put your child in a tub which has already hot water when you're putting in the shower. That has happened. And then burns can be electrical burns as well. You're trying to play with, a child is trying to play with a switch, and there is electricity shock, or there's a loose wire, and then he touched that wire, he can have these burns. Burns are different categories. Some burns are superficial, and I don't want to get into too much technicalities because obviously our viewers would like to know what to do. So there are different types of burns. Some burns can heal very well, and some burns takes a lot more time, especially when it involves the special areas. For example, your arms, your legs. The burns can be disastrous because sometimes the tissue, when the recovered tissue comes in, you develop contractures, which means your arm doesn't move as normally it would move.
That's during the recovery.
That's in the recovery phase.
Why is that so?
Yeah, so because it's like a scar. It's a bad scar which restrict your movement on the joint. So you have to be very careful with that. And burn could be anything from a simple burn. And the most commonest presentation to the emergency department is I just made a tea for myself and my wife, and the toddler who's just started walking came next to me and then he spilled the tea on top of him.
And that goes to the face, sadly.
It can go to the face, it can go to your hands, it can go to any part of the body. The most commonest presentation is face, chest, and abdomen. And this can lead to long-term scarring. They can have a mark, and then obviously prolonged recovery time.
So let's pause it there. Imagine this actually happened. So this tea or hot water spills on the child. This tiny child standing under the counter.
Yeah.
What is the first thing that a parent should do?
Yes. First and foremost, do not panic.
Yeah.
It has happened. We have to be careful with this in future. First thing you do is strip the clothes of the child, take them under the cold water, be it cold shower or cold water, and keep them under that burn area to be under cold water for 20 minutes. This is the recommended time. For example, if I burn my hand while cooking, put it under water, cold water for 20 minutes.
Cold is iced water? Or
this cold tap water should be okay as well. Yeah. But cold running tap water would help the burn to prevent the extensive severity of the burn. It will actually help you prevent to get it worse.
So it has to be immersed for at least 20 minutes.
Yes, under cold water. Even when they come to the hospital, this is what we do. We wash them. We check with the parents if they've washed them enough. We wash them. And one common mistake that people do all the time is that they put toothpaste. Yes, toothpaste.
Thing in India.
Yes, I've seen that. Some people like turmeric, and they put turmeric on them. And I know there is a lot of evidence behind, these things of being healthy and healing. But when it comes to the burns, what I would recommend is just keep it under tap water, cover it with a light dressing, and just give them regular painkillers before they come to the hospital. When they come to the hospital, we identify the area of injury because we have to find how much area was involved because we have to document that, and our treatment plan changes with it. We make sure the skin is okay. There might be an element that because of the extensive burn, the skin on the top is burned or dead. We sometimes have to clean that up, and then we have to put a specialized dressing on top of it. And then we refer to them for subsequent care. And subsequent care could be an expert hospital where they have burn trained people. If there is a certain percentage of burn, you can manage it at home and with frequent dressings.
Yeah.
But if it's more than that, your child might need hydration because they're losing water from the area of raw skin where the burn is, or they need frequent dressings.
Hydration meaning drinking water?
Drinking water, because it's slightly more than what you normally drink, you might need a drip for that. You might need a cannula and have a drip, and that will hydrate you. Sometimes you need to do more hydration. We get to see, in my experience, I get to see a lot of patients in house fire. And there are other aspects because of the house fire that they have, they inhale a lot of bad air that is or the smoke, which can lead to longer term problems as well. So burn is a very dangerous area. Obviously, it can be as simple as a hot tea spilled on you from a house fire, which can lead to consequences as a long term on the lungs, and it can cause you toxicity like cyanide toxicity and other stuff, which is too complicated. Yeah.
So you said about inhaling. So if somebody is in a burn situation or house fire situation, so if how many minutes of being in that or inhaling that smoke can cause into these damages?
Yeah, it depends about the proximity of the smoke, how close you were at the smoke. If you're in the next room, you can last for longer. But the sooner you get out of that situation in the clean air, the better it is. And the idea is to run for yourself and try to take anyone with you who cannot walk, or especially in your pediatric age group. Pick them up and try to open the windows so there's fresh air coming and the smoke goes out. So there's no time frame, but if you're close to that smoke, there's a high chance that you will inhale that. And not only that, sometimes the fire can touch your skin as well, and you can have your airway burn, which means your mouth, your nose can burn as well, your face can burn as well. Then that can create problems in breathing later on. So over my career, I've seen extensive burns, and the outcome is really bad if you do not get them the immediate care. So you have to be very careful, especially parents have to be very careful just before going to sleep, especially in the summer when we are very nocturnal. Kids like to eat food late in the night. We need to make sure that the ovens are closed,
Yes.
And whoever is cooking for them. So our new generation, the adolescence age group, they like exploring themselves, and they start cooking, and they think we have to. It's okay to do that unless as long as they know the safety netting and they know who to approach. God forbid if anything comes up.
There is a new thing that has come. I think my son, he's picking up this from the YouTube shorts or something. That's spraying the deodorant and opening the lighter.
God, okay.
Increasing fire.
Yes.
They do this.
Yes.
Boys.
Yeah.
So
this can lead to fire.
Yeah.
Obviously, anything that is in a pressurized can have the gases in there, and that gas are highly inflammable. So it's all written most of the time on these deodorants and these pressurized sprays that you have to keep it away from fire. Even keeping them in the car in extreme heat situation, they can burst. They can burst, and they can do damage inside the car as well.
Yeah, when you
So it's
when
not
you
recommended.
talked about car,
Yeah.
there are 2-3 cases which I've heard about, and sadly, during summers, that kids get locked in cars
Yes.
or school buses, and then
Yes.
they lose their life.
Yeah.
It's a very, very sad situation.
It's a very traumatic situation.
Situation.
Sadly, over the career, we've seen these sort of injuries, and it's not only specific to where we are; it's around the world. Especially new parents or parents who are under a lot of stress because of job, or they're coming off from the maternity, and they're not used to carrying a child. Not even children. Sometimes they leave their pets in there, and sadly, because the car windows are closed,
Yeah.
and there's no air conditioning on,
Suffocation.
they suffocate in the heat. They cannot breathe. Sometimes they develop high grade temperature, and they burn out their reserves of water in their body, and they become severely dehydrated, depending on how long they've been in there.
So how long does it take for a mishappen? Like what duration?
It's difficult to say the time frame, but obviously, and it's different from each age group. For in units and infants, anything more than 5 to 10 minutes can cause them into that sense. Especially when it's 50 degrees out there Celsius, your car is already heated up. The moment you turn off the AC or your car, you switch off the AC, you cannot sit in there for 3 minutes. You just try to run out, no matter how cool you were inside. You have to either come out or you have to turn it on. Just consider yourself in there for 10 minutes or 5 minutes, and it's so suffocating.
Yes.
And obviously the body temperature goes up, and you lose all your water from your body.
Sad.
Yeah.
Anyway, it's a lot of intense conversations.
It is, but it is the real world, Amal.
The real world.
We've seen this happening. No matter how many education podcasts are there, people like you who do these awareness things for people, that has helped a little bit. But I think we should be very proactive on these sort of things.
Now that we've mentioned about all these cases, you are the calm in the chaos. You're handling all this in this emergency room. So do you take this with you? Like, how does it affect you on a personal level? It's not easy. Like, your job is go there and then see lives falling apart, or trying to do, or be every second counts on you. So how does it take a toll on you?
Yes.
As a doctor? I'm talking on behalf of all those doctors who are in the emergency
Yes.
department.
I think it's a very difficult task, but someone has to do it. There's a high burnout rate, over 65% or 62 to 65%, some statistics, in physicians who work in the emergency department. And the reason is they see so much trauma, so much illnesses. And there are a lot of good success stories where you help people and you make them better, and you make life changes, events in their life. And there are some sad stories as well, where you see people that you've done whatever you possibly could have done, and then you still were not successful, or your team was not successful. So there are a lot of, I graduated in 2004, so it's been 22 years for me, touch wood. And I like the specialty where I am. And I think most people who work in emergency love it. But at the same time, we go through a lot of trauma, a lot of stress. But the best thing, as you rightly said, you have to be calm in that chaos, have to have a positive thinking that the last patient that I tried to resuscitate, I made him better. I brought a change in their family life. Losing a loved one is the most traumatic for anyone in their life. I can understand the extremes of age when it comes to a child, and then you feel that, what could have you done differently to avoid the situation to happen. So it's very traumatic, but at the same time, it's rewarding where we are, and how we manage patients. Everyone takes stress differently. Over the years, I've felt that there's a term called stress inoculation.
What does that mean?
So stress inoculation is every day you have certain level of stress, and you get immune to that. So today I've seen a cut on the head. Next thing I've seen a fracture. Next thing I've seen someone dying, and I see some success stories. So everyday stress makes you harder and stronger.
Yeah.
Hence the reason emergency medicine, the specialty that I am and I flag for, is one of the most intense specialties, and that you take a lot of stress home, but staying with your family, your loved ones, have some sort of recreational activities, help you pull out from that the daily negativity that you can get from all these difficult situations.
Yeah. And in your journey, you said it's been 22 years.
Yes.
Is there any one case or something that you could not forget till date, good or bad?
Yeah. So I'll tell you a good and a bad.
Okay.
So bad one, a very young 5-6 year old child who was hanging out from the top of the car in the desert, and the car lost its balance because it was in the sand. Oh,
The top roof.
the top roof,
They were
yeah.
standing
They were standing from there for the view, and putting some videos and TikToking or whatever they do these days. And the car lost the balance because it was on the sand dunes, and toppled few meters down, and he was crushed underneath the car. It was in the middle of the night. The bystanders called the ambulance. Obviously, the paramedics and the helicopters were there. They tried resuscitating him. They gave it a good chance, 30 minutes odd, rushed him to the hospital. We tried doing everything we possibly could, but we couldn't survive. The way I look at it is this one child who's 6-7 years old, probably could have turned up to be an engineer,
Yes.
or a physician, or an IT professional, or a very valuable person in the family. So that's the community's loss.
Yes.
Number two, the trauma that parent would go,
Yes.
or whoever was driving that car,
Yes.
will stick to them for the rest of their life. And when it comes down to the emergency department, I know we mentioned about these things that we see. It puts a lot of trauma on the physicians and the nurses itself, seeing a young child die, which was easily preventable.
Especially, see, okay, fun. There's fun, but you have to have the level of security also while having fun. Because even in the car, we are asked to put seat belts.
Yes.
So on the dunes where the surface is not flat, anything can happen,
Yes.
and this is not a very good idea. Your parents, all of us, we need to be aware of this.
Extra careful,
Yes.
because kids think they can do anything they want.
Yes.
And under a controlled environment, that's perfectly fine
Yeah.
if an adult is watching them. But like you rightly said, uneven surfaces or anything like that could have been prevented. They're a way to enjoy,
Yeah.
and I support people enjoying their life.
Yes.
But at the same time, you have to be careful.
True. True. Do you get a lot of cases where people forget to wear seat belts and then it turns into a fatal accident? Like if they wore the seat belt, it could have been prevented. Situations like that?
There are lots of cases where people, the kids especially, and parents are not educated very well in terms of doing this. Sheikh Hamoza has recently brought an initiative of putting kids into seatbelts, and the securities, the police, and they regularly, vigilantly check on the cars, making sure that kids are wearing the seatbelts.
Even on the back seat.
In the back seat, yes, more so on the back seat, and then kids under 1 years or a certain age group where you have to be in the car seat, holding the child in your arm and using him or her as your as your protection. Sad to say that will only bring grief to your family.
Yeah.
Make sure they are well strapped.
Yes.
They are if they are in the bassinets or they are in the car seat, they should be well strapped there as well. And I understand these things come with a cost.
Yes.
But then it goes a long way in the safety of your family. No one wants anyone. Well, don't want anyone to die in their family.
True.
So these sort of precautions, and there's a nationwide drive around it. I know there are big hospitals here where they're teaching people how to put seat belts, especially for kids, and how to make cars safer. The funny part is the cars are getting safer and safer as we get sophisticated, but the incidents are getting worse because, and the roads are getting safer as well. But the incidents are getting more and more because people are not getting it, that level of understanding and education. And I don't blame people. Some of them are not. I've never seen this in my life. I remember when I moved to this country. I was putting my child in the back seat on a car seat. People were laughing on me. It was like, "Oh, you don't do that." I was like, "Well, we have to do that. If you care about your family, if you love your kids, you have to do that." Yes. And yes, it comes with a little bit cost. It goes a long way.
Yes.
Try educating other people as well. Yeah. Making sure everyone understands the importance of it.
True. So now let's come to the good part. You said I have a good one to say.
Oh, yes. In my career, there was an adult patient that I treated. And this patient had a condition called AAA. For my medical colleagues, they can understand. To understand the general public, your body is supplied, your legs are supplied with a big blood vessel called aorta, and that aorta sometimes develop an aneurysm or like a cyst or a sac, and that can burst. It can kill you imminently.
So basically, in simple words,
yes,
it's called AAA.
Yes, abdominal aortic aneurysm. That's a very complicated word.
It's a sac kind of thing that's formed.
Yes, on the aorta.
Yeah.
And when the sac, because the walls are not thick, it ruptures. Oh. You'd bleed to death because that is the major blood vessel.
And you don't know.
And you would not know. The only sign you will see is the abdominal pain.
Wow.
So I had a patient in the middle of the night when I was training, and then we had a patient who presented with that, and then he had the rupture of that cyst or aneurysm, and then we resuscitated him, gave him a lot of blood, and got him to the operation theater. The chances were very thin for him to survive. And as in emergency medicine, we move on to see the next patient. And I forgot about him. We wished him all good. And then we forgot about him and we started taking care of more patients. 6 months down the line, I was seeing another patient. My nursing colleague comes to me and said, that family wants to meet you. And I didn't know. It's like, it's not my patient. So I went down to see them. And the wife of that gentleman who had that aneurysm rupture came and kissed my hand.
Oh.
And it's very difficult for a white person or a British person to do that. Yeah. She kissed my hand and she hugged me. This was a 70-year-old, 60-year-old lady who come and hug me. And I was completely oblivious what's going on here. And the nurse told me, this is the person that we met 6 months ago who came with aneurysm, ruptured, went into cardiac arrest. We resuscitated as a team of nurses and physicians, anesthetists. We got him to the theater safely and he recovered. Now he's got some complication with his legs, but he's alive. And that gentleman didn't know me. He didn't even know me. He had never seen me, never met me, but he was very thankful.
I'm sure that kiss that he gave was to the God's hand, or he must have felt.
Yes. Yeah. I think God helps us. We are only, the agents. Yes. We try our best as nurses and physicians. But that always sticks to my mind. Yeah. Because I can never forget that lady who came to me and she hugged me, and I was like, okay, everything okay? Can I help you in a way? And then can I have your hand? She shook my hand, she kissed my hand, and I was quite moved with that. And then when she said, I remember your face because and then I didn't even remember any one of them face. I didn't even knew she was there, but she was there in the background, seeing us working as healthcare physicians and nurses, working as a team towards providing a change in someone's life.
Yeah.
Yeah. So
It's very
Subhan,
touching.
yes, it is very touching. It takes me back to work every day.
Yeah.
Yeah.
God
That we
bless
can bring change. Yeah, all of us do a phenomenal job in emergencies wherever we work across the world, and we bring changes in people's life. Alhamdulillah.
Now, if there is a takeaway from this conversation, doctor, what is one message that you want to tell parents?
First and foremost, as me, as a parent, and everyone else out there, I would recommend everyone has to be extra careful when managing children at home. There are lots of injuries that can occur at home where you think it's the safe place.
Yes.
When you take them out for shopping, play area, swimming, or at the beach, you deserve to do that. You have to have a quality time with them, but you have to have extra caution in them. You have to be very vigilant with them. You have to do not ignore them just because they've come into the age group. They would need your help. Try giving them training, like some life-saving exercises, like having how to swim, learn how to learn swim, um, BLS, having an understanding about basic life support
Yes.
and how you can help people, and that goes for the parents as well. They should take some level of training, how to rescue someone, how to help someone in difficult times, and what's going around in the world. It's the safest thing to do, the safest thing to learn, that you can help another humankind, even if by putting a bandage or giving them a painkiller.
Yes.
Would will give you a lot of satisfaction that you've done something for a person.
This brings me to another thought also, because more than parents or with parents, I think the nannies should also be trained because they are the caregivers and they are the ones with children. Probably the parents are at work. The nanny is the one who's taking care. So maybe when we hire a nanny, I think basic few things or to do's should be taught. I think even at home, something that we have to think about.
Very good point, Amal. And kudos to bring this topic here. People need to understand that there is no formal training in most of the part of the world. There is no formal trainings to how to train nanny.
Yes.
These with ever still changing world, our lives, everyone's life is busy. You and your partner are working 24/7. You leave your kids to a person who you think is responsible.
Yes.
This person didn't have any formal training. So it is our responsibility and everyone's responsibility, even the agencies who let these maids and house helps, that they should have some level of understanding how to manage emergencies at home when the parents are not there. So I think that's a very good point, and I think it should be taken forward where they should provide support. And for the bare minimum that you can do as a parent is to tell them how to seek help. Make sure they know where the pain medications are,
Yeah.
and the support that you can provide them while parents are away.
And also something
And be
which
vigilant.
I actually do when I'm not home or I'm traveling or if there's a nanny there. I say, if you're in a situation, take a picture of the blue plate in front of your house and call 999 in actual emergency situation. This actually happened in my life also. My son, I was playing with a kid and a very unfortunate incident happened and I was not there at home. Me and my husband, we are not there. And this is something that we still have the trauma within us, and we still mourn for it. But then my kids actually they did the right thing. They called 999. They called the neighbors. They alerted them to come and help or offer support. So I made that awareness to them on what is the first thing that you can do, even if not on the medical terms. So I think every parent should do that, or even to the nanny, tell them this is the number. If there is anything, even before us, you can call 999 and then call us.
Exactly.
Yes.
This is called smart parenting, Amal, where parents are smart enough to educate their kids and their nannies or whoever, and it could be grandparents as well. Some of our grandparents are with our, they live with us. They have to have this level of understanding who to call, where to call.
Yes.
And paramedics, they're very vigilant, and there are lots of reasons why people call the paramedics, and seems that it is waste of their time. No, paramedics would love to come, see what they can do, and if it's something as trivial as nothing needs to be, there's no medical attention needed, they will let you know, and you do not have to come to the hospital each time. But there will be an extra expert pair of hands who will be there to help you provide the medical expert opinion. And if they think it's out of their limits, they will take you to a place where you can get a definitive care.
Yes. Anyway, there is this saying, Doctor, your name is Dr. Syed Haris Huda.
Yes.
So for those who don't understand, Huda is also called God.
Yes.
Yeah.
Well, Huda basically comes from Hidayah.
Hidayah.
It's from Arabic word, and Hidayah means who can give advice.
Oh.
So it comes. I'm not sure about Huda as a god, but it's for Hidayah,
Okay.
to giving advice to people, or
What
so, yeah.
is in Hindi? They say "Eh Huda" means what?
That's Khuda. That's with KHUDA. Yeah, that's in Khuda. Yeah.
Talk, and as you
Yes.
spoke about that incident, this just flashed my mind. Something just came.
Yeah.
So I just wanted to say, Doctor, not all superheroes wear capes. There are some who wear scrubs, and you are one of those, Doctor. Thank you so much for this insightful conversation.
Thank you very
I'm sure
much,
it
Amal.
must have helped many,
Yes.
including me.
Thank you very much for having me, Amal. And there are lots of people like me who are more senior or getting to that level, and nurses, physicians, paramedics,
Yes.
researchers, and people pharmacists who put their 2 pence every day to bring change in life. And that change in life could be a lifelong change for people.
Yes.
So thank you very much. And I'm sure your team, fantastic job. They're doing this awareness, and this can bring more good to the society and the community, inshallah.
Thank you so much.
Thank you very much.
Thanks for coming.
Likewise.